How are you?
Hi, very good. Pleasure to meet you all.
Likewise. And looks like you're zooming in from Boston.
Yes.
So are you a MGH?
Actually, I'm using my husband's Zoom. Yes, there is an MGH in the background.
Okay.
He's from Mass General Hospital.
Mhm.
Yes, Harvard Medical School. Yes, I am from New England College of Optometry, and I'm an optometrist.
Oh, great. I'm sure you see a lot of aging-related changes in the eye. It's one of the places that I think it's very visible, I guess.
Yes, yes. So this is actually our, project is we trying to coordinate our knowledge together and looking at retinal imaging, specifically optical coherence tomography,
Mhm.
into finding biomarkers in the eye for early diagnosis of neurodegenerative disorders.
Oh, interesting. So as a proxy for more central dysfunctions of aging. Very interesting. Hi,
Yes,
Claude.
yes.
Hi, Victor. You're welcome back. And your husband is also engaged in aging research then at MGH?
Yes. Yeah, so he's doing a lot of work on cerebral small vessel disease and dementia, Alzheimer's disease.
Mhm.
And ultimately we looking at the vascular changes as well as neuronal changes through the retina and how it can relate into the brain changes and see if we can really identify all those neurodegenerative disorders much early on, obviously cutting down on costs significantly for the screening of the general population rather than waiting for symptoms when they develop and then doing an MRI. So our thought process is that if we can identify it through the eye, very low cost imaging, and find these biomarkers and changes much early on and initiate
Yeah.
treatment much early on, we can really save many lives. That's our prediction. And
Get further into that as well.
June,
Yes.
Elaine is one of the Catalyst Awardees.
Oh, great.
yes,
And I think the application is really interesting using retinal images. So, and welcome, Claude. Let me just say a word about June and this kind of role model thing. We decided that we should have a session where you guys can ask questions of people who's done really interesting things. And you chose June, so presumably you know his background. You know, this whole health longevity actually idea came from June. He and I had a session together, spoke. He started working with a few researchers at Stanford and elsewhere about aging, and we converged in our conversation as well as in my President's Forum at National Academy, where afterwards we say, let's do something about this. And that's how it happened. Now, June is a radiologist trained at Duke, very proud of him, and of course at Stanford faculty, and then gone into you know investment. He's the head of Palo Alto Ventures, and so in many ways he's a great role model for thinking about a scientific question and being able to take it forward to say how to catalyze the field at the same time as a philanthropist being able to help me get started, but at the same time, an investor, a scientist. So I thought he would be a great model for those who want to understand the whole spectrum of how do you get started all the way to, if you like, his career path. So let me stop here and let June and you guys take over. Claude, welcome.
Hi, Claude. Welcome as well from my end. And I don't know if you guys know each other. We'll get into each other's backgrounds shortly. And Victor, thank you for that great introduction. Victor is one of my role models. I've shared the institutional path with Victor. I was at Harvard undergrad, medical school at Duke, and eventually residency and fellowship at Stanford, where I stayed on to teach. And so more in clinical roles and studies. Victor's had obviously national leadership positions, but Victor's been a great role model for this kind of thinking. He's also, as you know, He has experience in industry and in startups. He spent a lot of time in the Valley. So in many ways, my path is mirrored Victor's as well. So, you know, we can talk about all those things. There's no one right way to do this. It's a particular path. So I'll just briefly describe how I got to now. And then,
Joon, I may be in and out.
Yeah, all good.
I'm going to do different sessions.
Yeah, absolutely.
But I'm certainly going to be a fly on the wall because it's about you, not about me.
No, and it's great that you're presiding over multiple sessions here. You know, my particular background is I was always curious about medicine and biology and science with a particular interest in evolutionary biology. I used to read a column called This View of Life by Stephen Jay Gould. He was an excellent writer, and he made kind of science come to life. And I think that was a really engaging way to dive into not only how the body works, but really thinking about it from a selection perspective, competition, evolution, traits, adaptations. When I got to college, I used to roam the halls of the bio department, knock on doors, and you know, it's just kind of amazing to be able to step in. You know, there was always an open door policy at Harvard, and you know, these amazing professors that you would read about and read of would just welcome you in, and we would chat. It was not unlike these kind of sessions. It was really amazing, and I never forgot their generosity. So, and I remember making a vow to myself, if there was ever a situation where I could be on the other side of the table, that I would, you know, I'd welcome the opportunity to pay it forward. And so I've spent some amount of my time really engaging folks, you know, from around the world at all levels of the career, just kind of reflect back what I've learned and get to know them. And in many cases, I've stayed in touch with them. So that's kind of the cycle of life, of which aging is a part of a cycle of life as well. Because one of the folks, well, several folks that really shaped my thinking and interest in aging, E.O. Wilson was one of them. In addition to Stephen Jay Gould, he was a remarkable person. Charles Lewin, and Carol Williams. These are all just remarkable biologists that, you know, that are in the books, but they were like living creatures, still doing their work, and I'd go to the faculty club with them and meet their peers. And there was this generosity of spirit that I picked up early on that I've never forgotten. So keep that in mind as we shape all this, because I think we're all, you know, out there in science and doing work and, you know, making a contribution in different ways. Again, there's no one way to do this. I eventually ended up going to medical school. I started as a history major, by the way. I switched to bio because I just got interested in the earlier parts of history, and eventually get to biology. And really the questions of how we got to now. And I wanted the medicine for the consumption value, meaning I went there for the education. I really didn't look through to the potential practice of. I didn't have that kind of vision. I really just enjoyed the subject. It was kind of like graduate school, was the way I treated it. I found the content exhilarating. I mean, there were parts of it that I couldn't get my mind around. some of the subject matters interest me more than others. But then once you got into the clinical realm is when you started to see how all this became relevant for patients. It went from history to theory to practice was kind of the progression over the years. I petitioned the deans. You know, at Duke you get, they compact 4 years of medical education into 3, and they give you a year of research to really think about the science component of medicine. Stanford and Duke were the 2 schools that had the programs. Stanford offered it in 5 years, Duke was 4 years, so I ended up there. And I picked a project that I thought was the most interesting thing I had come across on my, you know, among my hobbies, which was AI. So this is 1991 too. And there was really, AI was probably the low point of AI. And then when you look, it was kind of peaked in the 70s, it's peaking again now. So 1992 was, we'd kind of run through all the algorithms of the, you know, the backprop models and heavy on networks. And And I read through the history of it. You know, I wonder if we can imagine combining evolutionary biology and selection and really thinking about how where intelligence is going, where algorithms are going. Back then we didn't have the computing power. So, I spent a year, I petitioned the deans and they graciously gave me the opportunity to just do AI research in medicine. And that's how I ended up in radiology, because we were trying to see, I was in Kerry Floyd's lab, just a remarkable team back then. They were pioneers in the field of using AI for the advancement of medicine and medical sciences. Looking back, we certainly didn't have the processing power or a lot of the knowledge that's been accrued. It was really the stone age of AI in many ways, but we were still able to be competitive with humans. So that was about the conclusion we arrived at. It's like, this is really interesting. This has the capacity, these neural algorithms, to really help patient care. So we wrote it up in the Journal of Cancer, and I gave a few talks, looking back again, it was really a remarkable time. The group was very small. I mean, even nationally, the number of folks that were doing AI research in medicine, and many of them ended up making massive contributions to the field. That was 20 years ago. And that's how I ended up in radiology. I was very interested in the intersection of technology and medicine. I guess what I'm trying to say so far is that I didn't really have a plan or a path. I was following my nose of curiosity, which is where I think how a lot of people start out in science. And that's where my nose led me. And I ended up in Stanford, which had, really interesting time, 1994. We're kind of coming out of the silicon hardware era, really right through the software era. And, the internet was just being birthed. So imagine landing in San Francisco. By the way, real estate prices had gone down 5 straight years. After 2 earthquakes, everybody was saying, don't ever buy real estate in California. It's all funny looking back. And, Netscape, Yahoo, all these companies that were, providing the interface and cataloging of information as it was just being born. And I think that's, I'll harken back to that as you think about the longevity field and the work that the National Academy is doing as well, to be, be a participant in a transformative era. There's just this excitement, there's energy, there's ideas, there's sharing, there's collaboration. And I think the spirit is really remarkable. And that's what I sensed being at Stanford during that era. So if you can imagine being out in the Bay Area in the early to mid to late 90s, as I was training and doing my residency and eventually fellowship. But, a lot of my peers and friends, we were all in our 20s, right, are out there, talking about this thing called the internet. They're talking about Amazon and, talking about search. And it was all happening in the barbecues in the backyard. I mean, not unlike how things happen now, right? And now maybe the rooms are more, online rooms versus, backyards. But there was this vibrancy that I'll never forget. And, there's always things going on in the world, but, it's great to be in front of remarkable people thinking about unbelievable things. And the other thing that a lot of us reflect back on is that as optimistic as many of us were, I don't think I was as optimistic as some of the people on the internet. I think people had more vision than I do, but I would say the contribution of the internet to knowledge, I think has exceeded even people's highest expectations. A lot of issues have come about too that we'll need to address, but it shows that how, in many ways we're linear in our thinking of how we forecast the compounding effects of transformation and ideas. I think even the optimists back then we couldn't foresee where the internet would be like where we are now. It's just kind of insane. We're on Zoom and, we're in different parts of the world and we're participating in the derivative effects of the internet, which includes the contribution to science, to medicine, and the aging sciences. It's all kind of crazy and mind-boggling. The fact that I entered the investment business was also, it's happenstance, as is often the case, including our careers and including scientific discoveries. I mean, at least half of it's just great fortune. And the fortune for me was, so I work at a firm called Pollitt Investors. It's a hedge fund. We're one of the older hedge funds in the world. It was founded in '89 by Will Edwards. Will came from a venture capital family. They were, speaking of pioneering, I mean, they started the concept of venture capital in the late 50s, 60s. So if you can imagine what it was like back then, we didn't have even the hardware companies and computing, they were all like, as big as houses, and we're just figuring these things out, and we could barely process much. But these folks, Will's dad started in 1958. General Draper, came out to California, and Bill Draper, they were friends from Stanford, and Arthur Rock, Bill Bowles. I mean, they were investing out of their own pocket. They were investing in people and ideas, just like not even proof of concept in many cases, just like, what do you think? So they were kind of the seed, let's just call it the Catalyst Award of venture capital, like just getting it going based on a proposal, and you believe in the person, you believe in the idea, let's take a chance together. Lots of things fail. I think there was an enormous tolerance for failure, that there's plenty of good things going on that are low risk that you can advance. That's where most of the market was. But the idea of really taking a chance on young people or young ideas with seed capital to get to that stage was the category they ended up inventing. They didn't call it venture capital, they just called it investing. And it later became known as venture capital. Some of them went on to create firms, and they ended up creating the category. And so they ended up being the founding investors of many of the big companies around the world. Our founder's father, Bill Edwards, was, the early investor in Amgen, and he held his Amgen stock till the day he passed. I mean, they were like just rocks. I mean, they're first in, try to get it right the first time. There are always gonna be mistakes. Nothing goes as planned, and you stay with them and help build. So they really were partners to, the entrepreneurs, the founders, the scientists, and then they ended up, creating this massive wake of interest in pioneering ideas and people, and help really create the Valley. So the Valley was the sum total of, entrepreneurs, investors, all the allied professionals that are associated with this category. And then from their birth, Will, who he, in fact, the F2 generations, as we say in biology, like Tim Draper and Will Edwards, the kids of the venture capitalists started the firms. And that's so I'm now like F3 generation of that stream of conscious investing, really thinking about what is valuable to people, what's going to make a big difference, and big ideas, bold ideas. So there I was in 1998, and the way I ended up in the firm was the person that was offered the job, another MD, turned it down to go to a venture capital firm. So I knew nothing about Palo Alto Investors, never heard the word hedge fund, and I walked into the interview really knowing nothing. I had these notions about investing being highly mathematical, and I enjoy math, but I enjoy the humanities just as much, and I had an assumption about it that was wrong. So I walked into a meeting with Will, and Will said, "If you come here, you will find truth." And I nearly fell over my chair, because that's what we hear in academia, right? We hear that veritas, pursuit of truth. That's what that's what people go into science for, go into education, go into academics for. But to hear it out of a hedge fund, what a phrase to use about investing. And I ended up taking the job on the spot. He was just so compelling, because I could tell he believed it. He looked in the eye. I could tell he was sincere, and I could tell he knew something I didn't know. There's something about this field, this magic of investing, that I didn't know. And I can tell you, within a week, it was pretty clear what this was really all about. Because when you're in science, when you're in practice of medicine, I should say, at that time, I was a resident. You're doing applied medicine. But when you're on the investment side, you actually hear the other side that you don't typically see. You're not on just the receiving end of the finished product. You hear from scientists, founders, CEOs. You see the other half that you never used to hear. And the sum total of everything you hear, both from the clinical end, the research end, but also from the industrial end, you're able to see things that no one company can see and no one center can see because you're learning all day long. So if you can imagine what my day is like, I literally am designing my curriculum day by day, being taught by the best and the brightest in the world, and I'm still learning at my age, 20 years in, right? So it's kind of an insane opportunity, right? So the things that we talk about mentoring, you can actually have that be your career. The curiosity now leads to perpetual learning, things feed on itself. And every once in a while, you find something that is absolutely amazing. And that's when you jump in and you partner. So that's kind of what my day is like and a year is like. We're learning all day long, and once or twice a year, everything just comes together. We're like, okay, this is the perfect storm. And then we end up putting capital behind it. And we will sometimes do a small investment, but our typical size is, a couple $100 million. So we really get deeply involved in our companies. We end up being the largest investor in a lot of our companies, and we stay with them and through all the journey. It really is like a marriage more than dating. So we are slow. We do a lot of diligence. We wouldn't get married on a reference check, right? So we would just keep dating, and sometimes we invest in these companies after 10 years. And it's through this path eventually, you come to kind of the next door, which is it's not just there's the practice of medicine, there is research, there's the capital markets, which we're part of, but there is also these other ways to contribute to the progress of knowledge and care of patients, which it really took this conversation with Victor, I think he's able to join us, and remembering the original conversation. Are there other ways to drive innovation? There's also the federal contribution, right? NIH funding. There's all these other mechanisms, nonprofits, philanthropy. You start widening the lens, as it were, to use your metaphor from your field, Elena, to really think about what are other positions that you can make a contribution from, and what are other modalities? And this is where, to circle back to the original conversation, now you're using an evolutionary lens, this idea of a grand challenge, using competitions to surface idea. This is how nature innovates. Can we mirror that as a tool for advancement of sciences, where you have a niche, essentially. That's what these awards are. There's an ecological niche, and see who can fill it. So you're able to pinpoint where you want innovation to go. The metaphor is very much like a canoe.
Joon, let me ask you a question.
Yes.
I mean, you talked about what you do and looking at investments and really potentially great innovations, because the magnitude of your investments, like 100 million. But in thinking about our colleagues here, how do you get started to get the notice and the support of a great idea at the very, very early stage? I mean, they're not even at the stage of forming a company, but yet in the nascent stage of having a great idea. Eventually you get to see it. But I'm sure that because you've seen so much of it, you can think back and say, take Elena or Claude's new idea. How do you get started to get the right support to get to where someone like you would say, yes, we'd like to help?
Yeah, thank you. And, sorry, it's so chronological linear, but Victor, thank you for bringing back, because these are loopbacks. So there's a bookmark earlier about venture capital, where it really is people taking seed risk, small amounts of money. And that's how the venture capital industry got catalyzed, as it were, back in the 50s and 60s. And so there's a parallel path here between how ideas started getting funding in the Valley that was very unique, and the way Victor and the leadership team here at NAM were thinking about a similar approach. How do you get bold ideas incrementally funded? So have a diverse number of ideas, create a niche. And these awards are often enough to get proof of principle, because the way it works in venture capital too is that remember, it used to be just an idea and a person, literally a sheet of paper, as we're talking about, right, back in the 60s. And this was the innovation of the venture capital industry. And they use the initial seed capital to achieve milestones and results that they were able to then widen the lens to approach a wider group of stakeholders. Number one, there are investors they can pitch, right, in Series B funders, but also talent and partnerships, because you use the credentialing and the results to then build upon. So much of venture capital is the sequencing of the work that really defrays the risk and the return across the whole life cycle of the idea. So that's where this Catalyst Award fits in, and it was Tachi and the late Tachi Yamada and Bob that really took this X Prize model and I would say turned it upside down, because the old model of the incentive prize like X Prize is you have the bold idea and then you see if people can achieve that. Well, it's not so straightforward, because in many cases you need some funding to get the results to attract enough capital to get these projects going, right? So really creating a pyramid approach, small amounts of funding, easier to do. It's an idea, put it on paper, and then have it be like the March Madness, have the tournament style approach to let the idea surface. Really was almost an upside down thinking that was absolutely brilliant. I mean, it took even me to really think through, wow, this is an innovation even within the incentive prize model. What an innovative idea, and that was catalytic, and that's what got this Healthy Longevity Grand Challenge going. And you are, two of the winners to get us going in this regard. I want to just spend some time, Victor. Go ahead.
Maybe my question for Elena and Claude is 50,000 enough to get going? You see the size of the prize, because we had to initially think about where the right level is. And particularly when we want to raise enough money to help this, we don't want to set the goal so high that we can't help a lot of people. But we are talking to foundations now to expand the prize, to extend the prize, giving even people a little longer time. And so I'd love to hear from you, and I'm sure Joon too, because he's really the originator of this whole thing. What would be a reasonable amount? Now, obviously, don't forget, I had to go to different countries. And of course, $1 in the United States and $1 somewhere else would be slightly different. But asking them to commit the same amount of dollars, I had to also find the right level, which is fair to everyone. So I'd love to hear your thoughts. Claude, you want to go first?
Sure. Thank you, Victor. And it's a pleasure to meet you all today. Thank you for your story, Jim. We have a lot of common touch points that maybe we'll explore together. But my original funding was from the Intel Research Council. CareWheels was the first 501c3 corporation that was not affiliated with an academic institution to receive this Intel Research Council grant. And it was on a yearly basis, but we won 3 years of merit-based grants of $100,000 per year that we used to establish a living laboratory in Portland, Oregon, to evaluate what was then called smart home technologies, now the IoT, to explore how these technologies could aid people to continue living independently and aging in place in their own homes. And I came from a research background at Lawrence Berkeley National Laboratory in the Bay Area, where I did technology transfer. And I learned that while it's exciting and challenging to crack the engineering and technology nuts, converting those discoveries, those inventions into an innovation that is adopted by the larger society is truly the hardest nut to crack. So I went to the Intel Research Council. I said, well, I want to actually install the smart home technology in people's homes. And they thought I was crazy until I suggested, well, let's not work with frail elders. Let's work with pre-senescent people with severe disabilities as proxies for those frail elders, because they exhibit some similar cognitive, motor, sensory, and other types of disabilities. The light went on for Intel. They realized this was a doable project, and we proceeded to do 3 years of participatory participatory design research with younger people with severe disabilities. And what they taught us was the importance of the technology to empower them to help each other. And that's where the Care Bank model came from that won the Catalyst Award. But back to your original question, $100,000 a year was enough to take off-the-shelf technology and to instrument a barrier-free apartment building in Portland for people with severe disabilities to begin doing this participatory design research. The $50,000 NAM Catalyst Award was sufficient for us to take the next step in our technology development, because what I've discovered in 20 years of working in the Internet of Things is that these technologies off the shelf are not particularly appropriate for elders and aging. They're not user-friendly. They're difficult to install, more difficult to maintain. And so I searched the Internet for the best solutions. I've tried many. They've all had failure points, but we were able to use our NAM grant to develop a Bluetooth 5 long-range sensor, which has the capability of doing full house sensing, and ultimately to be a very low-cost system, because as new smartphones come on the market that support this Bluetooth 5 technology, we'll be able to eliminate the data gateways and have a couple of $20 sensors reporting through the smartphone to our servers. And this, we're looking to be able to scale this thing. So unfortunately, we didn't advance beyond the Catalyst, but I'm seriously looking for funding to take this project to the next level, because I think it is super scalable. It's based on participatory design of using Internet of Things technology to connect people together to create peer-to-peer care networks, what we call peer care. So yeah, I've probably taken more than my turn to speak about this, but $50,000 is enough to get started. In our case, it wasn't enough to take the technology that we developed and to pilot it, because that's the next stage. We've got the technology in hand now, and it'll take another $100,000 to run a successful pilot, and that's the funding I'm looking for now.
Okay. Love to hear from Elena.
Yeah, absolutely. And hi, everyone, again. Yes. So on our end, just my, opinion, I think the amount definitely depends on, a few factors. One is the nature of the project and how much technology is being involved in a project, as much as, how many people are involved in a project as well. So on our end, again, $50,000 was really important, and we're very thankful for it. It really allowed us to get the project started. If you do think from the technology standpoint, the prices do go up every year. So if we think about OCT, for example, which is needed for our project, the optical coherence tomography, just to scan the retina, the prices range depending on the company. And if we want the newest, the best, right, with the best software, it already bypasses the $50,000 just right there. So obviously, as we trying to develop new ideas as a group, right, funding is crucial. And obviously, the more, the better, because then we can get better technology and really get those answers. I do understand from the investors' point of view, like, it's important to know how successful the project will be, like, will it work, right? Before, like, a lot of money gets invested into it. So, this is definitely important to consider. So I guess in short, Victor, it's great money. It's very, very helpful. But as we become more successful with our ideas, as we start seeing more successful results, the more money would be needed to keep going forward.
Joon, what's your advice?
Yeah, I got a couple of reflections on what you said. First of all, thank you, Elena, Claude, for both the work, but also the feedback. We internally debated this, Victor and the team. Like, is this enough? Is this the right amount? Will it get it going? Will it do the thing that we hope, which is to catalyze excitement in the field and ideas? And your feedback was tremendously useful. We're going to get all the feedback, really get it going. And it makes me realize this entire endeavor itself as a startup, even though Victor is bringing the reputation of the National Academy and all the members to bring to bear to really focus on this very important topic. But we know the best is yet to come, and whatever the design elements of this challenge for this, we can do better. I think every component of this can grow: the dollar amount, the talent, the ideation, the exposure. Hardest thing is always to get it started at all, which is just like a startup. And getting back to that 1994 conversation, Fred Gibbons, who was on our board at our firm for many years, he was a professor at Stanford, and there was a trailer parked outside his office where two of his students were living, and he knocked on the door one day and said, "What are you guys doing? They want you guys off the property." He says, "Well, we're like building this cataloging of the internet just to organize information. We're calling it Yahoo," and it was Dave Filer and Jerry Yang. And he gave him $25,000 on the spot. And that's what, again, once you build Yahoo, then you can go build other things. So when you think about the takeoff point, I really feel like this Longevity Grant Challenge that Victor's been stewarding and that you're participating in is just the beginning. And we're going to tweak. Nothing goes as planned. A lot of things we underestimate the upside. And I think it's already happening. So the community is being built, ideas being formed. And when you look at from an investor perspective or donor perspective, the fact that this is already happening gets them excited. The fact that some other projects now have been de-risked are exciting for them. So it allows different people to fit into different parts of this whole landscape, and the whole thing hopefully will start, and will continue to mushroom from here. So that's my initial reflection so far. I mean, we're several years into the whole process, but a couple years into really engaging the community and ideas. I can tell you that the reviewers too, the feedback has been tremendous. I mean, in many ways, the federal funding is supposed to do this. We used to think, okay, the government can really, and maybe DARPA, these agencies can really fund original, fresh research. But over time, they tend to not take as much risk. So the same reviewers now have the opportunity to do what we always thought we could do, which is just take, great people, great ideas, and just get it going. I think they're all excited too. So, and that's what's happened in venture capital again. It used to be venture capital, then venture capital started taking less risk. So now there's an entire cohort of venture investors that are getting back to catalyzing fresh ideas on a piece of paper.
Yeah, ideas like yours, at least in my world, where I'm a more traditional academic researchers, will not get funded, for sure. NIH don't know what to do with it. NSF don't know what to do with it. So there may be indeed other mechanisms, but certainly in my world, I'm not aware of any. So the whole idea that Joon and others came up with as a catalyst, I used to be chancellor at Duke. When I say to faculty, I can give you $50,000 for whatever you want to do with a good idea, believe me, the whole student body will be applying. So while on one hand, it seems to be kind of, modest, on the other hand, really get things going. And that's what we hope to help you do. But we recognize the next steps ahead. And so the next session is called Accelerator Award. And that's when we have J&J and European Investment Bank, and now a Japanese firm to say they put down money, but they will get to choose what they want, although they're not taking IP or whatever, they get to choose to help you incubate further. And I think, to be honest, I don't know who they've chosen. It could be you guys. So you're gonna have to tune in the next one to find out. But nevertheless, I think the whole idea is to now, okay, we're going to give you a lot more money for a great idea that you have to go to the next level. So I'm trying to open as many doors as I can. It's still not enough. I need to open more doors for the next phase. So as I said, the idea behind this would be to extend or expand the Catalyst Award. And by the way, there's nothing prohibiting you from reapplying again. And then to be able to get then more people next stage who can say, hey, that's great, because I get to see a lot of things. Joon likes to do that too, right? And then, of course, Joon has helped us think about the one that you should be going after, the Breakthrough Award, the grand prize. Joon has put down personally, if he doesn't mind me saying, $2 million, along with somebody else, and etc. So we have, as a few years from now, you guys can go for the big award of $4 and $5 million. That's the idea of that pyramid, right? So we're still trying to refine this. And that's why I'm so glad that you're open to talk to Joon and me as we're trying to figure out what kind of resources. We have no secondary gain, right? We only want to do the right thing. I'm passionate about this. So thank you for those inputs. Joon, any other wise words in helping them think through this, or any questions, Elena or Claude, you have?
Victor, I'd like to share an observation. I applied for the J&J Accelerator Award, and what I sensed from it was that there is a strong bias toward, let's call it orthodox or conventional medical approaches to longevity, rather than approaches that address everything from the social determinants of health to the digital and ecological determinants of health, which are becoming very important right now, particularly during this climate crisis and with the tremendous inequities in our society right now. Interestingly, I attended Jack Rowe's presentation prior to this one, and he said that the U.S. spends far more on medical than social services and technology development compared to Europe. And this is something that I've discovered over time. Coming from a background in biomedical engineering, but having learned that the really underserved and underrepresented needs are within the social sector, and indeed the low-hanging fruit in terms of how we can apply our technology for connectivity, for AI applications to be able to predict things that are going to happen, just to support human-to-human interactions to overcome things like loneliness. These are the real low-hanging fruit where we have the technology, we have the infrastructure, but we're not really applying it here in the United States. We're seeing growing inequity. We're seeing that the vast majority of elders are not prepared financially, socially, spiritually for aging. And I'm looking for holistic solutions to that. And while I applaud ma'am and your work and your contributions, Joon, to make this happen, I want to point out that what I'm observing is that there is a medical bias.
Yeah. Well, that's, I won't say it's a bias. It's probably where the emphasis is. We certainly did not go in with a bias. But when we look for funders, Jay's willing to do it. And they are, by definition, a biomedical organization, right? So European Investment Bank is different. People can argue that you, Claude, have a easier pathway, easier in quotes, than biomedical. Because if you think about biomedical research, what it takes at the bench, what it takes to translate proof of concept to human, and what it takes to eventually get approval FDA, it's much more longer and complicated pathway than the digital pathway. So I think the bias is on both sides, quite frankly, that you may well be able to move your innovation much faster to get product to men than a biomedical concept. I think what you're seeing in the bias is only got to do with the funder, because that's who we're able to convince to fund, and not in a kind of, what's I call, committed commercialization. They're willing to help incubate. I'm trying to get others to do the same. And to the extent that we can get Google and others to do it, it'll be great. We're still working on it.
And Atlanta, we want to hear your feedback. I think we got 1 minute left. So
we just got a new attendees, Kunbao Lu. Welcome.
I'm sorry, my net is not very good. It seems that I missed a lot of things. I'm from China, and I'm interested about capitals because during the competition, some capitals in our country is very interested about our project. But I'm kind of puzzled because I have done some homework to research on to study their capital forms in our country. I have categorized them as the 3 forms. Maybe one is pure capital. They just pour money in and they want the money back. They don't care about what we are doing. And I didn't like this kind. And the other one is a very good example. It is, I think everybody knows that it's BioNTech and Pfizer, right? It's from the lab to the product, not just money. That is very good example. I think if there are investors here, maybe you should, pay more attention to this kind of style. That is what scientists care about. The third one is, I call it patience. There's a successful example in China. One company, they sell waters, just the waters we drink. The manager, maybe, I don't know, maybe the leader, once he visited the university in our country in the midnight, and he saw a lab, all of the lights are, light on. So he knows, right, there's a very diligent professor here, there's a very diligent lab here, and I want to just pour money in. And he pours maybe $300 every year, and for more than 10 years, maybe 20 years, and at last, this success. And it's their HPV vaccine in China, from Xiamen University. And I don't know, maybe that example is very rare, but that is maybe what scientists want. I have, not invested, I just call the professor, ask them, hey, you are not in the company on the market. You are not on the board. There's a lot of millionaires maybe over there, but there's no your name. The professor just said, I didn't care. They still pours money in our, the lab, maybe $300 every year. And I didn't know, we don't care they earn money or they lose money. What we know is we have money to do our experience. I think there's a very perfect maybe example we dreamed of, but I don't know, not everybody can meet that, right? That was what I want to share with everyone. And maybe you are interested. I hope you are interested. Thank you.
Well, thank you. I mean, it's the fact that Victor and the team were able to take this globally. We're learning so much about the way other cultures and other environments are tackling all of these big issues, including aging. We know that like in our country too, if you look at what's happening in Climate Week this week, and Jeff Bezos just committed $1 billion to climate. It took 20 years to get there, but the engagement is strong. So we are learning about how different nations are engaging these important topics. Aging is going to affect everybody. So and we know that the culture of venture capital, science, they're all different. So we're all in a learning mode. I think the more we do this, the more we can learn from each other. There's already so much hybridization and crossover activities, both scientifically, also the review committee funding that's happening through this kind of collective global endeavor. And I think that's why it's really important to have global voices in the room and in this process. So welcome. And I'm sorry, I think we're at the end of our time. I put my email contact on there. I would love to follow up with each of you. Number one, to learn more about your work, and also just be engaged with you in this process. This is a long journey. We're probably in the infancy of this field called aging, which is ironic, right? I mean, this is an old field in some ways, but we're just really hitting, I think, this inflection point. And we'll look back at these conversations and this era you know, I think with a certain amount of awe. So thank you, congratulations, and thank you for being part of it. Please reach out. Also put in my cell phone. It's easier to text me. Emails tend to get lost. I'll put it on here, and would love to follow up further. But thank you for making the time today. Great to meet you guys, and good luck on your projects.
Thank you so much. Yes, and thank you for sharing your personal story, Joon. That's great.
Thank you. Bye bye.
Very much.
Thank you all. Take care.
Bye now.